Jain Dental College, Kashipur, Kolkata. This is the department of oral medicine and radiology. It's an outdoor clinic. This is the department of oral and maxillofacial surgery. Dr. Tanmoy Guru is a leader of the department. He's from Bangladesh. Outdoor, basically, and we have a minor OT facility over there.
Okay. So this is a huge setup.
Now we are going to CSSD department, Central Sterile Department. From 8:45 to 9:30, there is a different cycle. We have a lot of things. They are even like, see, the cleaning is going on. All the students coming into our department, cleaning. Then ultrasonic
Vibrator.
We have a separate register making and take all the
This is
instruments.
the out point. All the sterile instruments.
We have a different, you can see the different almirah for different department.
So they keep all the instruments separately and
Time to time they dispatched.
okay.
This is prosthetic laboratory where patient work is done. No need for students. It's not for students. It's for only patients. We have dental technician, very experienced person.
All the prosthesis is
All the
there.
processes work is going on, and full-fledged everything done here. All the machine, dusting machines, centrifugal dusting machines, all we have the facilities. This is our
Public health department.
So, I'll show you. Department of Prosthodontia. Madam is coming from Bangladesh.
So we have a good OPD, touching almost around departmental OPD, almost about 90 patients per day, including new and old patients as well. So we try and wrap up by 3:15. Like if there are old cases pending, that is continued, but newer cases, it's almost done. And we have referral cases also coming from other departments, which we look in at after 3 o'clock. So we have all sorts of prosthetic work in our department, including complete dentures, removable partial dentures, fixed prosthesis, implantology. So all that is done, and we take care of student work as well.
Any maxillofacial processes?
Maxillofacial also. We do. We have made a couple of obturators in the past in the department, and that's about it.
Oh, implant training.
Dedicated for implantology.
For implant issue, you have another three.
That's it. There is a Sorry, ওটা গার্লস হোস্টেল, এটা বয়েজ হোস্টেল।
পিছনে গার্লস হোস্টেল, সামনে বয়েজ হোস্টেল।
Vaccinated that time from our department of oral pathology.
During COVID,
during COVID period. We are strict to
no ragging for the students.
this is but one of the small
Lectures.
Then it will be পুরোপুরি গাইড বাই RMS প্রিন্সিপাল তপনগিরি স্যার, দেন অমিত রয় স্যার, আর একজন রেডিওলজিস্ট কেউ একজন আসছেন, মানে যাতে তিনটে অ্যাসপেক্টই আমরা কভার আপ করতে পারি, প্রসোডন্টিক অ্যাসপেক্ট, তার সাথে সার্জিক্যাল অ্যাসপেক্ট, তার সাথে রেডিওলজিক্যাল অ্যাসপেক্ট, এবং তার সাথে পেপার প্রেজেন্টেশন থাকছে, ইউজি পোস্টার আর পেপার প্রেজেন্টেশন। এই পেপার প্রেজেন্টেশনটা আমাদের এই সাইড অ্যাপসেই হবে, ঠিক আছে, সেই দুদিনে। তো আমরা পুরোপুরি চেষ্টা করছি যাতে যত
principal sir is our HOD, and that's why principal as well as HOD we get privileged the department. And every year we have listed different journals from our department and we display. There is a madam reader. Madam, please introduce yourself and
Hello, I'm Dr. Lakshmi Sen. I'm an associate professor in the Department of Oral Pathology of this college. And our department basically entails in doing biopsies and giving reports, and finally giving the diagnosis to the diseases that occur in the head and neck region. So our department has 5 faculty members. Principal sir is the head of the department of this department, and we have 3 more other faculty members, of which Dr. Shetty should be inside. Dr. Momita Bhattacharya is also there. And we teach first years, third years, the subject of dental anatomy and histology, as well as in third years we teach them oral pathology.
Okay.
Please come.
Department take the dekhi.
So this is the preclinical training laboratory for our students. We teach the first years and third years here. And this is the display system, which is connected with the master microscope, which is set inside the microscope room. So the master microscope will focus the slide that we want to teach, and the screens display that master image across all these tables, and this allows for ease in teaching, which enables them to exactly visualize what we want them to see. And this is the microscope. So the attachments, this is the light compound microscope, but we also have the polarizing as well as phase contrast attached to it. So when we want to change the mode, we just change the eyepieces. And this is the pentahead microscope. So 5 people can sit together and
See a single
see
slide.
one slide at a time. So this is basically for our PG training program. So we've applied for masters. We're done with the first batch of undergraduate students who just passed out last year. So we've now applied for MDS, and it's 6 subjects. So we've just gone through the first few stages of inspection, and we are waiting our students in the coming year. So we have about 100 students in each batch. So this lab holds them all together, and this is the histology and pathology laboratories. So once the specimen is received, both blood as well as tissue samples, we bring it to this section. So this is the histopathology laboratory where the tissue is processed and sectioned. This is the microtome. So the sections are then stained over there. That's the staining section. So once they are stained, we then observe it under the microscope and we give off the final diagnosis. And this is the pathology laboratory where we have both immunohistochemistry as well as regular blood collection and urine samples.
it's a full automation. And we have the setup of immunohistochemistry lab.
Yes.
So it's wonderful. Huge actor setup.
So this is going to be our PG room. So we've applied for 1 unit, which is basically 3 PGs per subject. So this is going to be the PG room and the library. So once we have the PGs, they will be basically sitting here in their reading time. So the library come PGC.
It is all done by uni students. Our
Wow.
model and this.
So many posters.
This is the blood sample connection area. And this is our clinics, which has 5 dental chairs. And all our patients who come with lesions or any oral pathology related diseases, we inspect them here. Both the examination as well as the procedures are done here. So unlike most oral pathology departments, ours is also a surgical oriented department. So along with oral surgery and other departments, we do our own biopsies and we process them. And this is an additional unit, which is the forensic odontology unit. So this is basically to be tied up with Kolkata police. So we've set it up. We are yet to get into the formal, affiliation with them. So once that happens, we will be able to basically work at crime scenes.
Okay.
But we have done studies where we haven't done on actual, crime-related issues, but we've definitely done other studies where we've sampled anthropological studies, where we've studied different kinds of patterns in the bone, in the jaws, and all of that. So.
This is a new concept for me and for any private dental college. I have seen government dental college, they are doing this, not a dental part, the forensic part is doing same in collaboration with some other dentists.
That's right.
But this is the first time I have seen any dental college
Yes, it's
having
in
this
West
kind of
Bengal, you're
department.
right, probably the first. I'm sure,
Yes, probably.
other than a few.
Mokusim is the first. What is it?
Sunderlal Dugar Jain Dental College and Hospital is a unit of Shri Shwetambar Stanakvasi Jain Sabha, which is a philanthropic organization which has been working towards the benefit of society, basically focusing on the educational sector and setting up different kinds of hospitals and schools all across the city and in the suburbs to enable, the people of the underprivileged sections to avail of such facilities. So this college started in the year 2016, wherein we started to establish this hospital with the guidance of Dr. C. Bhaskar Rao, who's the founder and father of Dharwad Dental College. And he is one of the most eminent dentists in the fraternity. And along with Dr. Jayanta Chattopadhyay, who is the principal of our college presently, they both work together to set this up with the idea of making it one of the most state-of-the-art colleges, giving our students an extremely exemplary as well as clinical-oriented education. And keeping that in mind, every department has been set up with the finest infrastructure as well as extremely erudite and young faculty members to train our students to the best of our capacity. So at present we are in the 6th year running of our institute. We have 9 specialty departments, and of these 9 departments, 7 departments are going for post-graduation, and we are hoping for getting our first batch of students in the next year. And with the 7 specialty departments running in full capacity, we treat our patients in all the fields of dentistry, giving them premium treatment as well as advanced healthcare services. And being a philanthropic organization, we almost render all our treatment free of cost, and the basic pricing, which cannot be avoided, has been charged, but 90% of the treatment is free of cost. And we also have an extremely well set up mobile dental van, wherein we go to distant suburban areas providing free dental services to people of the underprivileged sections. And we also have a satellite clinic in Sri Sharada Math in association with Ramakrishna Mission, and our teachers as well as doctors and students go there every Monday and Friday, rendering free service to the members as well as to the patients who come to Ramakrishna Mission. And all that has been happening at a very quick pace, and we hope to keep going forward, and our aim is to become one of the best dental colleges in the country and hopefully known worldwide too. And we are taking quick paces towards that, hopefully, and hoping to be one of the best in the country.
Surely.
The Department of Conservative Dentistry and Endodontics. So this caters to both the undergraduate and PG section, which is coming up soon. So we have about 100 to 150 patients coming to this department every day, and we render all kinds of treatment almost free of cost. So both restorative as well as endodontic treatment is given here, and our faculty are extremely, in the best capacity, with being led by a very, very young head of the department, Dr. Devi, and we have other faculty members sitting here, Mr. Korna Jana and Dr. Priyanjit Shaha. So, yes, Dr. Shomadip Mondal is still there, and we are training our second years, third years and final years as well as interns in this area, and that is the endodontic microscope which is set up. So we like to give our students absolutely hands-on experience, so they are allowed to start clinical experience right from their first postings in the third year, and they're doing everything, restorative treatment as well as root canal treatments. So in final year, in internship, they're doing posterior root canals, which we never got an exposure to do. So we want our students to pass out as competent dentists and be ready and well equipped to start their own clinics as they pass out. So we don't want to restrict their exposure, hence we even allowing them to use rotary systems, and once they go through the very basic training, we are allowing them to even use rotary systems. Encouraging towards giving our students the best infrastructure. So there is no limitation on the kind of equipment. If anybody wants something the most advanced, they are ready to give that to us. We just need to ask for it, and 90% of the things that have been asked for have been procured for us. So this is the preclinical phantom head room in the Department of Conservative Dentistry, where the students start training in the patient position as well as having almost simulated intraoral experience, preclinical experience before going to approaching the patients directly. So they have a very rigorous preclinical training before they start doing the patients, and they prepare all the types of cavities and do the restorations in this setup, and once they are approved, they move on to the clinical area.
A huge library.
Journal facilities. We have all
Okay.
the journals.
Research papers.
So we have about 300 odd seating arrangement ekhane. So that is the journal room, e-library, where people can access it from there. Bhedore ache faculty reading room, and these are for PGs mainly. This section will be for PGs particularly. Ekhane amader undergraduate students roshe.
It's concept. একেবারে বাচ্চাদের মতো করে বাচ্চারা খুব খুশি হয়ে যাবে।
Yes. Bright colored chairs.
হ্যাঁ সেটাই, চেয়ারের কালার থেকে শুরু করে প্রত্যেকটা চেয়ারের উপরে কিছু না কিছু টয় ঝুলছে।
And one thing which we have here is that our faculty is very young. So
They have new ideas.
they're new ideas, more energetic. We extremely compartmentalized thought process where this is to be done like this and that is to be done like that. We don't have that. So new concepts and new ideas are very easy to implement because we don't have that old generation ekjon kyo who will resist that thought, resist that
Now we have
implementation.
changed our syllabus study also, like competence based.
Our complete orientation has become competence based, where we've gotten rid of the examination system. Jekhane, of course, the preparatory exam will be a formal examination, but during the entire course what we're going to do is they're going to be based on their acumen. Mane, say in a particular department they require these skills. So every stage they will be evaluated on the clinical as well as the academic knowledge. So that entire system of study we are changing it, trying to make it more in tune with the foreign universities, where they focus entirely on these competencies, that in a particular department, what are the things you're required to know, whether you know it, how well you know it, how to improve on it. That is how we are now moving forward. We taught at the undergraduate level. So ETA we are starting on, where implantology and this entire training the students will receive as they pass out, before they pass out.
Thank you so much, ma'am, for your time.
Is it
You have
better
described
to polish
so
on
well.
it?